Your dentist says the deep cleaning helped, but some gum pockets are still too deep to reach. Gum flap surgery is a procedure that treats advanced gum disease when cleaning above the gum line is not enough. The gum is lifted gently, like opening the flap of an envelope, giving direct view of the tooth roots. Doctors commonly consider surgery when pockets stay deeper than 5 millimeters, bleeding continues, or X-rays show ongoing bone loss. The procedure is usually done in the dental clinic under local anesthesia and typically takes 1 to 2 hours. With direct view, the surgeon removes tartar and infected tissue from the roots and smooths any irregular bone. In some cases, the surgeon places bone graft material or a membrane to help the body rebuild lost support. The gum is stitched back in place, often slightly lower on the tooth, so the pocket becomes shallower after healing. Recovery is usually manageable. Swelling peaks around day 2 or 3, and most desk workers return within a few days. For a couple of weeks, soft, cool foods, gentle brushing away from the site, and an antiseptic mouthwash are commonly advised. Expected effects include mild tooth sensitivity and some gum recession as the inflamed tissue settles into a healthier shape. Periodontists describe the goal as long-term control, with cleanings every 3 to 4 months and steady daily home care. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.